else. Oh. Oh, 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 oh. They jacking me all again. Okay.
Yeah.
That's right. All right.
Next one.
Next one is, you have the name. Keely. 6-year-old Chihuahua mix. Good old Keely. Hello, how are you guys doing today?
Okay, good.
Good. Jonathan Goodwin. Good to meet you, sir. How are you doing today?
I'm exhausted.
Oh,
I was
so
up
sorry.
all night with this one.
What's been going on?
She's doing better.
You gotta give her a break, brother. What's been going on with the baby?
So she was coughing badly, so we took
For
her.
about a week.
Okay.
And not so bad. And the day before, she was like, okay. I took her for a walk in the woods. She was just fine. But like yesterday, she sounded bad, and her breathing was not good. And they put her on oxygen, and they did a million tests on her.
Okay.
And they couldn't tell me what it was, and I said, I think she has pneumonia.
Okay.
And they gave her antibiotics, and I think she's better today. Her breathing is more normal.
Yes.
She's eating food. She's drinking.
Good.
She's doing all those things. I think her gums are pink.
Okay.
So I just want to check out that she's like okay.
Okay. Just take a look at her heart and see what's going on and make sure there's nothing there. Her white blood cell count was a little bit up, so, I mean, definitely could fit with your pneumonia. Her left lung has a lot of congestion in it and little crackles, so. Did they send the x-rays, do you know?
Yes, they sent you the
Perfect.
x-rays.
1, 2, and 3. There you
Okay,
go,
I'm
sweetie
sorry.
pie. Just laying on your side, that's all you're doing. Nothing bad, okay?
Feel free to tell me I did a good job.
I think you did a great job. I just don't know the answers yet, but that's what we're going to find out for you. Yeah, this looks like pneumonia to me.
Not crazy.
No, you're not crazy. But usually what they'll do is when they have significant pneumonia, if they're uncomfortable, you can hospitalize them.
Yeah, they wanted her hospitalized,
Okay.
but I said, like, you don't
You know,
know what
we're
it
in a
is.
strange place.
You're in a.
It's just the only thing that trumps love and attention is oxygen.
Yeah, but I think she's okay. Like,
Okay.
I think she's
Well,
gonna be okay.
Well, you have the option. The beauty is, we can try at home and then 261, 540. We can try at home and then if it's not working, they don't ever close. So 2:30 in the morning, you'll be like, you know what? We're going in. So no pressure. All right. So this is our left atrium here. Mitral valve, left ventricle. Right atrium, tricuspid valve, right ventricle. Left side, right side. The right side should be 1/3 of the size of the left side. And right now it looks like the right side is bigger than the left side, which means that the lungs are where the problem is. The heart's job is to receive blood from the body and push out to the lungs, and receive blood from the lungs and push out to the body. The right side pushes out to the lungs. The lungs are way smaller than the body, so the left side's way bigger because it's push out to the whole body. If the right side is getting bigger than the left side, that means the lungs are under significant stress, so you have to work harder to push blood out into the lungs. Does that make sense?
Yes.
So that just fits with exactly what you thought all along, pneumonia, and that's what this is.
Are there
Most likely.
steroids we can give her to open her airways?
Good question. Steroids don't really open the airways very well.
Okay.
But what does open the airways is oxygen. So that's where it gets a little tricky. For her, what looks like it's happened is the pulmonary hypertension has developed, or high blood pressure in the lungs has developed, maybe secondary to this pneumonia that we're calling it. And so that's the part that makes her breathe like this. So what you'll want to do at home, if you're going to try it at home, we're going to get you on the right medications. And then aside from that, I would get a couple of big floor fans, plug them in, leave them on high, just leave them on all the time.
Okay.
She'll put herself in front of it, and that
Right.
air blowing in her face will make it
Okay.
feel like she can breathe better.
Okay.
Okay? And if it's, like I said, if you feel like it's not working well enough, that kind of thing, then
How would you know if it's not working well enough?
What you can start seeing with her because of the severity of this, like if she tries to walk across the room, you can see her pass out,
Okay.
faint. So those kind of things are kind of scary to see. If you're seeing something like that, and you're like, I don't want to keep doing this, I want to get her in, you can.
Okay.
But she would typically be a pup that would be in the hospital for about 72 hours straight in the oxygen while getting the antibiotics and getting the right medications to help her fight against this high blood pressure in her lungs.
So
You
what
guys are
kinds of
awesome.
medication are you going to give her?
She's gonna have a little team of those. So I don't know what's going on in her lungs, but I probably would start her off with a drug called an antibiotic called Clavamox. Is she better with pills or liquid? What's going to be easier for you to administer?
Well, can we do the liquid through like a dropper? Cause then
Yes, yes.
Yeah, I can do a drop.
Okay,
'cause
perfect.
that's how we were giving her water last night.
Perfect. Okay. So yeah, then we'll get you all liquid meds. We'll make it really, really easy. I'll call these into the pharmacy and get these made up for you, and they'll get them to you fast.
Okay.
We can at least get you the antibiotic and get you going. But yeah, it's gonna be our big battle. So letting her rest, like she wants to, be in the fan blowing on her, see if that helps.
Okay.
But like I said, if things are scaring you or not going the right way, you feel like her breathing's getting worse, then you can always bring her in, okay?
Okay.
Perfect.
Actually, her breathing has gotten better.
So
since
much
yesterday.
better.
Good.
So I don't know if that's the antibiotics that she got yesterday kicking in,
Or even the oxygen that
or that she got some oxygen yesterday.
Yes, sir. As long as those blood vessels are more open, carrying more oxygen, then she'll be able to exchange oxygen.